like to recognize Dr. McCormick for 5 minutes of questions.
Thank you, Mr. Chair. First of all, I appreciate everybody being here today. I appreciate your heartfelt testimony, the experiences that you've had that have made you who you are and why you're involved. In my experience, over 20 years in the military and finishing up as an ER doc, and as a matter of fact, from the beginning of the pandemic, I was serving as a night shift ER doc, full-time, working in the ER, being exposed to fevers we didn't know where it came from, and trying to figure out what this novel virus would do to our patient population, and we got it wrong. I'll tell you, when a novel virus hits you, or any novel disease, you don't know what to do. That's a fact. So we're the healthcare professionals, the people with the scientific background, the people who understood how viruses work, how they propagate, how they create inflammation, got it wrong. We're going off of old technologies, old assumptions. And I remember we were intubating people that probably shouldn't have been intubated. We didn't use NSAIDs. We didn't use steroids. We didn't take into account how this virus could be different from other viruses we knew in the past. Let me tell you what else I witnessed as an ER doctor. I watched families struggle with this. Once we were no longer able to allow families into the ER, I watched people die by themselves. I held the hands of people who were dying and looked in their eyes and told them I was going to do my very best, but knew there was very little I could do because we didn't know what to do. I watched and prayed with people knowing that the outcome was going to be very poor and knowing we were doing some things very wrong over time and realizing as it continued, I became very aware that the government was the biggest problem of all. They didn't help this pandemic. They got in the way of the conversation. They interjected themselves between the professionals and the patients. They kept families apart. They didn't let people even die with dignity or with any choice in their own health care. Let me ask you this. This is my take home, is why do we keep on turning back to the government to solve the problems that the government created? That's what I get out of this. Every step of the way, the government has biased us and been wrong almost every step. Let me give you some examples. Origins. Will we ever get to the, when you bias people on where the origins came from because the government seems to think they know where it came from, you can't actually determine if we funded the origins of this or how it got here because we can't have honest conversations. This is the government getting in the way. Vaccinations. Whether they benefited you or they're a detriment to you, when you politicize something, some people that should have had it didn't get it, and some people that shouldn't have had it got it later because of the government involvement. Treatments. We already know the government was weighing in on it way before they had any clue what was good for you. And that biased medical scientists and doctors to do the wrong thing because government was involved. Patient placement. I think we've covered that here today. Travel. Masks. School openings, business openings, censorship of physicians who are treating patients because the government was supposedly the expert instead of the physicians, making people think this was a political disease rather than a virus. We've trampled all over individual rights, the ability to self-determine, the ability to think on ourselves and actually have an honest access to information to make good decisions rather than biased information coming from a government that's biased already because of what you guys already said, lobbyists, people who put money in your pocket, people who want power, people who love the fact that they can make decisions for you because they seem to think that they're experts or because they're powerful and we have to succumb to them, that we the people are subject to a government. When you say we need to be ready for the next one and say we need rapid testing, for what? It won't be COVID. The next one will be something else. The problem is we keep on thinking that the government's going to prepare us for the next thing. We have to have a flexible model. We have to allow scientists and doctors and hospitals to be ready on their own, to prepare them by not overburdening them with regulation and fees and non-reimbursements because of special interests not allowing us to get our hospital systems healthy. I don't have any questions for you because I know you are the solution, not me. You guys have already talked about the hurt and contamination of this conversation because of the government involved. So I hope we have a real conversation about where the government shouldn't be involved and how they actually hurt the conversation. And when we politicize any disease, and I love how sometimes my colleagues from the opposite side of the aisle say, we should not make this political. By the way, Trump's at fault. This is not helpful conversation. Let's get the government out of the way and empower the people to deal with the disease or whatever else problems they have in life. And with that, I yield, sir.